killing somebody knowingly is either voluntary manslaughter or murder. When Luigi Mangione shot the CEO, he took the law into his own hands. He actually knowingly killed somebody. He will likely have a price to pay for that. And the media, and we hear the district attorney in New York, and everybody is talking about that is now how a civilized society works. We are a body of laws, and laws must be followed. I agree, laws must be followed. We must not unalive. We must not kill. We must not murder people. We must not cause the death of people knowingly. But then, because of the way our society is structured, we don't necessarily treat all who commit murder, all who kill the same way. Because you know who is a big culprit of killing thousands, hundreds of thousands of Americans every year? That is health insurance companies. We pay health insurance companies as a group so that whichever one of us are unfortunate enough to get ill, that they will cover what it costs to make us well. That's the pact. And if the service that you are providing or denying actually causes the death of somebody, we should have laws that treat them the same way our current law wants to treat Luigi Mangione. It's murder. So our CEOs, those people who deny services to people who doctors say they need it to save their lives, should be treated as the murderers that they are. For the politicians who, because of ideology as politicians in Texas, in the Texas legislature, who deny coverage to poor and lower middle class Texans, even as the money is there to pay for them to have medical coverage, those politicians should be charged as well with murder. I am not being hyperbolic here. I mean it. This morning I saw a piece on MSNBC that brought me to tears. And you know why? That woman who lost her husband, that woman who was denied the PET scan to find her cancer early, and in the delay and the delay and the delay, the cancer has returned with a vengeance. That is murder, or the precursor to murder. I want you to listen to this snippets of this MSNBC report, because this is why we need to get the private sector. This is why we need to get private health insurance banned. They need to be out of healthcare, and we need to have Medicare for all, or some sort of healthcare run by one entity where there's nobody cracking up millions of dollars in profits. Check this out, and then we'll take it on the other side.
It's becoming an all too familiar hurdle for patients battling cancer, and that's the extra challenge of getting their insurance company to cover their treatments.
Kay Sue has been battling cancer for nearly a decade. One of the hardest moments was in 2018. The cancer returned, stage 4, metastatic.
Did it feel like a death sentence in that moment?
Absolutely. And it still does. It's almost like being on death row and just waiting. All of my off-label drugs.
Remarkably, she was able to battle the cancer back, but her oncologist said it could return again, and PET scans were key to detecting it.
How often do you have to get the PET scans?
It should be 4 to 5 months.
A schedule she followed until her private health insurance changed to Cigna. And she says the company wouldn't pay for the screening.
They thought it was not medically necessary.
Does your oncologist think it's medically necessary?
Yes.
So does Dr. Ashley Sumrall from the American Society of Clinical Oncology.
PET scans are all part of accepted guidelines. That means that multiple experts agree that a PET scan is appropriate.
But Cigna refused to pay for the scans, which can cost $10,000 to $15,000 each. Sue's doctor appealed and was denied. With the delay in her screening, Sue worried the cancer would return. Angela Pike understands that struggle well. Her husband, Tracy, was diagnosed with stage 4 stomach cancer in 2023.
He was so sick, he went from a 250-pound man to about 130 pounds.
Tracy's doctors in Louisville ran out of strategies to help him. They said he needed HIPEC surgery, a kind of chemotherapy that a cancer center in Houston agreed to perform.
It was about 10 or 11 o'clock at night, the night before the surgery, where we got a phone call from the surgeon himself that the insurance had actually denied the surgery.
In the denial letter, Blue Cross Blue Shield of Illinois said HIPEC was experimental. But here's what the American Society of Clinical Oncology says.
HIPEC is no longer considered experimental. It has crossed the threshold into widely available treatments.
But not for the Pike family, whose surgeon appealed, only to be denied. At one point, the mother of three took to TikTok with her guitar, hoping someone might be able to help them.
The surgery was only $42,000. They put a price tag on my husband's life, and they decided he wasn't worth $42,000.
How desperate did you feel in those moments?
It doesn't get more desperate than opening up your guitar case and standing in front of a hospital in 100-degree weather in Houston.
He never got the treatment. Instead, his cancer spread. And roughly a year after his diagnosis, Tracy Pike died at the age of 46.
Are you left wondering what would have happened if he had gotten that procedure?
There are definitely a lot of days where I've thought about that.
In a 2022 survey, clinical oncology professionals were asked about the effect health insurance authorization had on patient care. 87% said they resulted in denials of therapy. 80% said they resulted in disease progression. 36% said they resulted in patient death. Blue Cross and Blue Shield of Illinois, Pike's insurance company, declined to comment on her husband's case, adding, "We are committed to increasing access to safe, appropriate, and effective health care based on the best available information and research." Sue's insurer, Cigna, tells NBC News, "We strive to do our best to ensure that each person gets the appropriate care as quickly and easily as possible. We fell short for Miss Sue." Cigna contacted Sue after NBC News reached out to the company for comment on our story. Sue did ultimately get that PET scan this fall, she says, but only after her employer paid for it out of pocket.
Your health is in the hands of an insurance company. Do you feel like they care about your well-being?
No, I don't think so. As a result of me fighting for that PET scan, I found out that I have metastasis to my liver.
The screening that had been delayed confirmed her worst fears. Her cancer has returned.
Now, folks, this is in our hands. We allow them to snow us. We allow them to tell you that somehow having one system for healthcare will deny you service or would have you in long wait lines. Have you been to a specialist lately and have to wait 2 or 3 months to see a specialist? Have you been and asked for a service and wasn't delayed? It was simply denied? That does not happen in France. That does not happen in England. That does not happen in Canada. That does not happen in Taiwan. That does not happen in China. That does not happen in third world countries, Panama, Costa Rica, in all these other places. Yes, we may have the best care money can buy, but when you have the majority of your population that doesn't have the money to buy that health care, they are sentenced to death. And we have this system because they have snowed enough of us to believe that if we took healthcare away from the thugs and the thieves who run it right now, that somehow it would be worse than it is right now. It cannot get any worse. We can only get better. And the amount of money we invest in healthcare would give us great healthcare if we took the charlatanes out, if we took the thugs and thieves who collect millions of dollars of your premiums, of your Medicare dollars that the government pays. These guys are sucking on all of us as they run to the bank without providing any meaningful service. We have to wise up, folks. It is time. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel, and number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.